يا جماعة بس معلش ما تكتبوا اللينك تاني، يعني ما تكتبوا اللينك حتى في الجروب.
Okay, are there? Hello?
لو يا بروف أي سامعينك شايفينك، سامعينا؟ الفيديو قفل يا بروف.
Hello? Hello?
ألو يا بروف سامعينك وشايفينك، الصورة
سامعين؟
واضحة، سامعينك؟
ما شايفيني؟
أي
شايفين كمان؟
أي صورتك واضحة وصوتك واضح.
اوكي، انا بالنسبه لي ما واضح، لكن الصوره نو. لا، الصوره هم شايفيني لكن انا ما شايفهم، ما شايف نفسي. المفروض يكون في كونتينيو هنا جاي. أروى؟ ألو؟
أي بروف.
ألو؟ شايفين واضحة؟
أي الصورة واضحة والصوت واضح.
طيب، بسم الله الرحمن الرحيم. This is yet another lecture in the series of tropical and infectious diseases. I would just like to remind everybody, especially those who have not been with us in the first lectures, that tropical teaching of tropical disease in universities has been rather deficient and been neglected in some way. It is an important subject for many reasons. Reason one is the whole world is now looking at Africa for more development and for interaction. And you have heard very recently, about a month or 2 months ago, the big gathering of the Arab countries with Africa and the donations to Africa. Now, Rwanda is being seen as a developing country, which is largely supported. So it's Africa has been on the spot. So it is important that people would know more about diseases which are prevalent in the African country. However, we should remember that tropical diseases in Africa is to a large extent getting under control. This is because of the urbanization. More cities are developing at the expense of the forest. And number two, high education literacy is becoming, increasing, and health education is becoming more on site for people to know a lot about diseases, and obviously the increase in communication and IT has helped a lot of people to look into what the diseases are. It's unfortunate that people are less and less specializing in tropical diseases, particularly parasitology. Now in Sudan, maybe that we have one or two. The late Professor Kardaman, who has been one of the eminent parasitologists, but now we are short of that. So it is a joint effort by physicians, parasitologists, therapists, and occupational therapists who are helping in rehabilitation of diseases, of patients with these diseases. Okay, we have dealt with many diseases now. Some of them are what we call classical tropical diseases. Some of them are classical tropical diseases like filariasis, lymphatic filariasis, onchocerciasis, lawa. And others are more or less, widespread in tropical, subtropical, even in Mediterranean regions like schistosomiasis, because this is associated with the canals and irrigation. Thirdly, we would like to emphasize again that there is a lot of research which has been done on tropical diseases, which had led to major breakthrough in the control and elimination of some of the tropical diseases. So standing now, if I will look 40 years back into these diseases, we see quite a lot of progress. You with me? Hello? Hello?
Yes,
أيوة
معاك يا prof.
Okay. So if you look back 40 years back, you can see that there is a lot of progress in the research, in the diagnosis of tropical disease, and majorly on the therapeutics, on the treatment. And indeed, the discovery of new drugs, of not only very effective but safe, with high tolerance, patients tolerate them, and high margin of safety. These characters have enabled drugs to be given once a day, once in a treatment, and have lent themselves to mass chemotherapy. And mass chemotherapy, what we call preventive chemotherapy, has led to not only control some of the disease as health problem, but also as in elimination of some of the diseases. So we are in an era which is very important in the history of tropical diseases, being neglected for so long, but now with the discovery of these drugs, we can really deal with tropical diseases in a manner which will lead to control and elimination. If you remember, we have talked about 4 major drugs, and these 4 major drugs will treat at least 70% or 75% of all tropical diseases. These are albendazole, ivermectin, praziquantel, and in some areas DEC, which is diethyl carbamazine. If we remember those 4 drugs, then you are safe. If you learn about them, then it is wise, but more than anything else. If you give them, you can be happy that the cure rate can reach up to 70-80%. And if you repeat them, then if you repeat the drug every 6 months or every year for so many years, you are aiming at not only reducing morbidity in an individual, but reducing the overall morbidity in the community and aiming at control and elimination of the disease. So, having said that, I would like the young generation to have some interest for the following reasons. Reason one is because we are in Africa now and we need to know these diseases. Number two, because there is an expansion in the relationship between Europe, America, and Africa. So we need more doctors. Europeans and Americans, we need more doctors to work in Africa, and they have to know the current environment and the current diseases which are being tackled. So today we're going to talk about intestinal helminth or intestinal worms. Okay, worms are animals, invertebrate animals, which has no bones, no legs, but they are still have male and female. They are heterosexual, and they can produce various types of diseases, and they are among the most common diseases in African countries, especially children. So if you say Geohelminths, this is what we talk about, and then we call intestinal helminth. And helminth, which is Helminth, helminth. Okay, it's worm. So it's if it is intestinal, then we talk about intestinal helminthiasis. Iasis meaning disease caused by helminths. Okay, intestinal worms can be roundworms or what we call geohelminths or others. For instance, you can have ascaris, which is a geohelminth, or you can have tapeworm. Tapeworm is the worm, is like Tinus agenata. It's not a geohelminth. When we talk about geohelminths, geo is earth or soil. We can talk about earth or soil transmitted helminth. This is why we say it's STH, soil transmitted helminth. And this is like ascaris, ankylostoma, these roundworms. Okay, they are related, the infection is related to the soil, contaminated soil with feces. While other intestinal worms are contracted by other methods, like Tinus agenata is contracted by eating beef, which is raw beef, okay, from cow's meat, which contains the larva. So let us restrict ourselves in this lecture to geohelminths. These are soil-transmitted helminths, STH. And they constitute quite a large number of worms. They are very different, although they are intestinal, maybe small intestine or large intestine, but they very vary in their life cycle. Some of them are being swallowed eggs, very mature eggs, which can turn into an adult very quickly, or eggs which has to mature. And some of them are being larvae in the soil penetrating the human skin, like ankylostoma. Ankylostoma is by larvae, which is on the soil. If you go barefooted, the larvae of ankylostoma can penetrate the skin and walk up its way to the intestine. So they are varied, and this variation in life cycle will lead to better control. If you know the life cycle, you lead a better control of these worms. So it's the most important thing when you talk about these worms. We should learn that it is soil transmitted, meaning that the soil is contaminated by feces. So if we talk about intestinal worms, then we are talking about intestinal related infection. So the eggs will go into the feces. So these soil are contaminated by feces, and in the field, in the gardens, and in whatever there. So it's an infection which is very much related. If you touch the soil with your hands, if you eat whatever there in the soil, like vegetables, fruits which are not clean, then you eat the eggs. And the eggs go in and mature into adult worms. In epidemiology of these diseases, it's a disease mainly of children. It is a disease mainly of children. When people grow up, then they tend to have less and less disease. So it is, if we really target children for treatment, then we are just like schistosomiasis. If we target schistosomiasis for treatment, children for treatment, then we are targeting almost 65% of the burden of diseased personnel in the community. So remember that this is a disease of children. Second point which you should remember as a cover information is that the pathology which develops with intestinal worms is very much dependent on the number of worms you harbor. So what we call intensity of infection. So much so that the WHO is characterizing the intensity of infection for each worm, if it is mild, if it is moderate, if it is heavy. And pathology all will come up only when you have a moderate to severe infection. So in essence, the patients with intestinal worms, if they harbor a mild infection or few worms, they are asymptomatic. They are completely asymptomatic. They don't complain of anything. Even the moderate infection does not cause a lot of pathology. If you have heavy infection, then this is where we can have symptoms related to the infection. The Geohelminths or soil transmitted diseases are being described by their characteristics or by their shape. Just to give you some examples of these worms, like Ascaris, 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 and it is called a roundworm. It is rounded. Okay, Enterobius vermicularis, which is other name is Oxyuris. Enterobius vermicularis, Oxyuris, is called pinworm or threadworm, like a thread. Okay, and then we have Trichuris, Trichura, which is called whipworm, and whip is soft. And you have a handle of a whip, and then you have a very thin part of it tapering, and this is very much like the worm called Trichura. and it is called whipworm. Ankylostoma duodenale. Ankylostoma duodenale is called hookworm. And then your Tinea saginata, which is not a Geohelminths. Tinea saginata is not a Geohelminths. It is called tapeworm, like a tape, sharit. Okay, so it is not a nice feeling that worms comes out of your body. Okay, so you feel like you are rotting inside. So it's a feeling which is very nice, which is not very nice. And this happens with some worms which find their way out, like Ascaris lumbricoides, which is a round worm, which can reach up to 30 centimeters. This is a long worm, very long, and maybe the longest. It's very long. It comes out of the anus. Sometimes the children will just see it coming out and in the pants, or children can vomit, and when they vomit a worm like Ascaris. I have seen it in the endoscopy. When we are performing endoscopy, the worms creep from the small intestine because this is where it lives. It creeps to the stomach, and you can easily see it by the endoscope, and you can even catch it and get it out just for fun. I mean that. Sorry? Hello? Okay, you still with me? Are you there?
أيوة.
Okay. So it is not nice to have worms coming out of your body. So in summary, worms are common, all right, all over the world, particularly tropics and subtropics. Some of them are even in temperate climate, high social class, as we're going to see with some. That's number one. It is a disease of children, okay, and it is asymptomatic in the majority of patients because they have light to moderate infection. They only cause pathology when they are heavy infection. But having said that, there are some symptoms or signs which relates what we call subtle disease of worms, even if they have a moderate infection. And this is in children, they have stunted growth. They don't grow fast. Number two, there is anemia. Usually there is anemia. Some of the worms don't cause anemia, but the majority can cause anemia, maybe due to malabsorption, maybe due to less eating, because some of the children will develop loss of appetite. So stunted growth, the child will not grow fast, anemia, and impaired cognitive function. Impaired cognitive function meaning that they cannot get good education. They don't perform well in the schools. What is the evidence? The evidence is when mass chemotherapy has been given with albendazole, which is a treatment of choice for intestinal worms. When that was given to over a few years, then the growth of children was better, anemia disappearing, and cognitive function, students are doing well in the schools. So even if we say there is no symptoms, there is a subtle effect of these worms in children. So it's important to remember that we should clear the worms. The major problem with treatment of worms or controlling of worms is reinfection, because if you treat a population and you don't attend to the environment, the feces on the soil, and children are playing, are going barefooted, are eating without washing. So the reinfection comes on and on. And this is why we say there is difficulty in eradication especially when you are dealing with children. Children are not organized, you know, they are not disciplined, they cannot be disciplined. And so it's a matter of just continuing as much as you can to decrease the intensity and the prevalence of the infection. So it's important to remember that we have a lot of work to do in the tropics, particularly education. These diseases are diseases of poverty. They are diseases of inadequate sanitation because people just excrete in the open, and it is diseases of illiteracy. Okay, so if we provide good water supply, if we stop defecating in the open by providing enough sanitation, and if the education is level high, then we are safe, and this is the way to control this infection. Okay, let us start with one or two of these intestinal worms. We start with the very simple, the simple worm, which is Enterobius vermicularis. Enterobius vermicularis, and I have sent you some the names of a lot of these worms, so that you can at least know the spelling. But for those who did not receive those, Enterobius, Enterobius, Enterobius vermicularis, vermicularis, vermicularis. Other name is oxyuris, and as we said, it is either pinworm or pinworm and threadworm. So this is a very simple worm which lives in the cecum and the terminal ileum. It burrows itself in the folds of the intestine, in the mucosa, buries itself and burrows, like inserting itself within the villi, and living there as an adult worm, male and female. Then they copulate and they produce eggs, and then the female will travel from the cecum up the colon, and then transverse colon, and then down in the descending and reaching the anus to lay eggs outside in the perineum. So it's a very cunning worm which finds its way to the external environment by laying eggs in around, after it gets out of the anus, around the perineum. So the female is about 1 centimeter, and the male is about 2 centimeters. I'm giving this size and length because you may need in the diagnosis to identify, if you see a worm, you need to identify what is this type of worm. But anyway, if you can't remember, it's okay. So this worm lays its eggs around the anus. What do you expect as far as symptoms are concerned? Somebody, if the worm gets outside and lays eggs, what is the symptoms will be? Somebody? Marwa, Ruba, the names I remember. No one there?
Itching, pain.
Badr, are you there? Ma'ab?
Itching or pain.
Your voice, I can't hear you.
Itching.
Yes,
Pain.
itching, that's very good. Itching. So this is a worm which doesn't cause a lot of pathology, but cause maddening itching. Maddening itching. It causes a lot of itching, and it's particularly in children. It has a very peculiar itching is during the night because the worm finds it cool during the night, gets out, and then lays the eggs, and the itching is so severe that it can even cause pain around the anus, which is in the perianal region. So it's itching, and itching can result in other symptoms. Okay, it can cause insomnia, which is loss of sleep. The child will be irritable and restless, and then loss of appetite, and he can or she can have enuresis, which is urinating during sleep at night, nocturnal enuresis, nocturnal urinating in the bed, which is related to maybe the insomnia and the restlessness and irritation. So it's a nuisance worm, what I call a nuisance worm. It doesn't cause anemia, it doesn't cause gross retardation, but it can be a major nuisance for the child. And the child with insomnia cannot go to work. He can very, very embarrassing socially if somebody is scratching his perineal, especially among people. The problem with this worm, despite the fact that it doesn't cause a lot of pathology, it's reinfection. Okay, the reinfection, which occurs quite often with children because the eggs are being excreted through the anus. If they rub or scratch, then they can catch the eggs in the fingers or under the nails, and then when they swallow, they have their fingers in the mouth, then they swallow the eggs back into the body, and they develop more worms. So you can imagine how we can control it. But apart from itching around the perineal, in females, the worm also finds itself into the vulva, and they cause vulval mucoid discharge and vulvulitis, and may cause what we call urticaria or pruritus, like pruritus ani from anus. Here we call pruritus vulvi, itching around the vulva. But it has very little as far as when the adult worm is just in the cecum. It may cause inflammation, it may cause ulcers, but the major cause is the itching, which can occur. Okay, how is the eggs contracted? Because this is important for control. Number one, we have already said through the fingers and fingernails. The eggs can be found in the underwear of the child. So people who are not careful handling the underwear or towels, then they can catch the eggs and swallow it. And sometimes the eggs can go into the air with dust, and some people can swallow it from the air or the dust. Okay, not very common, but it can happen. So the whole essence of the life cycle is reinfection and what we call auto-infection. So if you control that, then you are safe. So it's a nuisance worm. It can cause no anemia, no eosinophilia, no stunted growth, but anal pruritus, pruritus ani. That is the importance about it. So the diagnosis is easy. When I say easy, it needs some skills. You can have a sellotape around the perineum. You just put a sellotape and then take it out and then deal with the sellotape to see under the microscope. You can see the eggs. You can see the eggs very clear there. And then this is the thing. But the clinical pruritus ani, even if you don't see the eggs, justify treatment. And the treatment is very easy for cure. But because of the reinfection, you need to treat the whole family. If you have a child or in a school, you have this worm, then it's wise to treat everybody in the family with albendazole. Albendazole is a very, as we said, very safe drug, which can be given clearly in multiple occasions, maybe every 2 weeks for the whole family, and coupled with warm cleaning of the clothes, okay, with warm water or with hot water, and then stop sharing towels, stop sharing clothes between children and between adults. So that is the way to cut it down. It's often seen in institutions and houses and hospitals and in schools. So that is the Nusus worm. And then we talk about Ascaris lumbricoides. Ascaris lumbricoides. Ascaris is what we call the round worm. The round worm. Okay? And Ascaris is notorious because it can cause intestinal obstruction. So it's called the roundworm. It's very common, and it is among the most common worms, which in the tropics. It is estimated that 450 million child have this worm. It's very common in many parts, not only subtropical, tropical, and can even be in temperate climate. The worm, the adult worm, is, as we indicated, the female about 3 centimeters. The male is up to 30 centimeters, can be 15 centimeters, up to 30 centimeters. So it's very visible when it comes out of the anus or it comes out of the mouth. Then it is extremely visible, being rounded, very nicely rounded with tapered ends. This is clearly seen and diagnosed. So how can children contract Ascaris lumbricoides? It's in the intestine, and they lay eggs. The eggs goes in the feces, in the soil. But very different from Enterobius vermiculars because the eggs are immature. When they are laid in the soil, they need about 2 months to mature. So if you see them as they are laid, they are very opaque, nothing there, but they mold. They develops infective larvae, then molds into rhabditiform appearance, okay? And this is what is called mold 1, is maturing number 1 of the larva, okay? The first, if it's just laid on the ground and it is swallowed, it doesn't cause any infection. But if it takes 2 months, then becomes mature larvae. Then if it is swallowed, then it becomes easy to be swallowed in the stomach, in the intestine, and it hatches into a rhabditiform structure which penetrates the mucosa. Are you still there? Hello?
Yes.
Okay. So you have to remember that with ascaris, we have two causes for pathology. Okay, the adult worm. The adult worm lives in the small intestine, And because of the number of the high intensity, this number of ascaris can form a ball like. They can join themselves into a ball-like in the intestine, and they can cause a lot of symptoms like abdominal pain, dyspepsia, epigastric pain, maybe vomiting sometimes. And when you vomit, you may vomit the worm itself. But it can each these balls can reach to an extent of causing intestinal obstruction, like a ball obstructing the bowel. And you know the symptoms of intestinal obstruction. This is an acute surgical emergency. It can also cause volvulus. Volvulus is an intestine intercepted into another volvulus. They go in, one goes in the other one, and this is end with obstruction of the intestine. So this is the major. I also send you an intestine which has been opened with ascaris inside, causing the intestinal obstruction. So that's the adult worm. The second pathology which can be caused by the adult worm is a state of malnutrition, and it is mainly due to malabsorption. It is known that these worms cause some degree of malabsorption of particular proteins and vitamin A. So it's an anemia results in loss of protein and not loss of blood, not like ankylostoma when it is mainly loss of blood. So it is the worm, the adult worm, causes this pathology. But if you follow the worm as it enters the body, before it establishes itself in the intestine, then there is a lot of pathology which can occur. Okay, let us follow the eggs. The egg is being swallowed. As I said, it is in stage 1 larva. Okay, they hatch in the intestine. Rhabditiform. Rhabditiform is a elongated small worm which penetrates the intestine. If it penetrates the intestine, it goes to the portal system, and then via the liver, it may causes small necrosis in the liver, but it passes to the blood, systemic blood, and then goes to the heart. And from the heart, it is pumped into the lungs. And this is where the problem arises. Okay, these worms will go in the blood system and reach the capillaries around the alveoli. They cannot penetrate further, but they go and stick themselves into the alveoli, and they find themselves in the alveoli, and from the alveoli, cunningly, they creep up in the small bronchioles, in the right bronchus or left bronchus, into the trachea, in the larynx. You see how cunning this worm is? Reaching the larynx, then they jump over the epiglottis. If you remember your anatomy there, they jump over the epiglottis to find their way into the stomach. And then they go down in the stomach. During this period, about 14 days, 16 days, they mature. And when they reach the stomach, they passes into intestine, and this is where they rest. Finally as adult worms. Okay, why do they do this? It's not very clear, but it's definitely that the passage through the body like this, they mature as they grow, and then they settle into the intestine. They passed the intestine twice. They passed the intestine when they were larvae. They didn't like it at that stage. They have to penetrate the intestine and goes all round and come back to the intestine in the second round to settle at the final destination of the worm. Okay, what happens when it goes in the lungs? The larvae is an allergic, causes allergy, and this allergy may present with asthma-like, okay, wheezing, cough, sputum, mucopurulent sputum, and may contain some of blood. But it is an emergency. It's an allergic asthma caused by the larvae, and it is important that you should not use any drugs like albendazole during this period because it can aggravate the syndrome. And this is called Loeffler syndrome. And Loeffler syndrome is spelled L-O, and the O has two dots. Loeffler's Loeffler's L-E-R-S. Loeffler syndrome. This is an allergic syndrome. You can have eosinophils in the lungs, and you can have pneumonitis due to the eosinophilic infiltration and eosinophilic granuloma, which can occur in the lung, and it's an emergency. During this period, the patient can have a wheeze, can have a cough, can have a fever, which is can be treated by anti-allergic drugs like corticosteroids. So it's something which you should remember with ascaris, and this is what we call ascarid pneumonia or ascarid pneumonitis. Okay. And it is, the other name is larval ascariasis, lung allergy or lung pneumonitis due to the passage of the larva, or called wandering. Okay, so it's something due to the larva, and it is important that we should recognize it. In areas where this ascaris happens, the suspicion is high. You can think about it, when you have an acute asthma attack in a patient who had never had asthma, you have to work it out, okay? It's not easy to diagnose, but if you do an X-ray, then you can have mottling appearances or infiltrates, small infiltrates, which tells you that this is something which is not normal. And then if you have, for examining the blood, then you can see eosinophils, very high eosinophilia, especially during the attack. And then the high suspicion, the important thing is you should not use albendazole at that particular time till it settles. And then when the worm settles in the intestine, you can use the albendazole. So it is that area that the eggs, from eggs to eggs, it takes about 2 months. It takes eggs to eggs about 2 months. So if Aedes ascaris excretes eggs in the stools, and then it was rapidly taken by a human being, or after it's been molded in the first mold, it becomes infective. Then if it is taken, from the time it is taken to the time it grows into an adult worm to produce eggs themselves, then it takes about 2 months, eggs to eggs. So it's the ascaris has a prolonged pathway in the body. Okay. In the liver, it may cause some necrosis in the liver, But otherwise, the worm can live happily if it is in a small amount in the intestine, and the patient will not get into any particular illness. The diagnosis is obviously through the stools. Examining the stools, very easy. The worm, the eggs are very clearly seen. If you catch it early from the feces, then it is the non-infective eggs, and it is a characteristic. Parasitologists will know it under the microscope. They will know it very, very clearly under the microscope. Later on, if the patient passes ascaris, the round worm, through either the mouth, vomiting it, or through the anus, which is more common, then seeing the adult worm, with that length rounded, ascaris can be easily diagnosed. So that is the diagnosis. Secondly, you can do an ultrasound. You can see the worm, within the intestine. And before the advent of ultrasound, people were using barium swallow. Barium swallow goes to the intestine, and you can see like filling defects. These worms rounded, making a ball-like. They can appear on the barium swallow as filling defects. Being common, very common, you have to have high suspicion of the ascaris, and then this is amenable for treatment. There is something called pica or geophagia. Anybody knows what is geophagia? Geophagia. No one? Pica, ما عارفينها? You don't know? Okay. Are you with me still? People there? مزمل إبراهيم? No? محمد فرج الله? Arwa there? Disconnected? Hello?
Yes, we can hear
You
you.
can ما تقولوا can hear you لحد ما أنا أقيف كده. Okay, so it's pica or geophagia are children who eat mud. The children who eat mud. Okay, it's called geophagia. Geo is earth. Okay, phagia is like esophagus. Okay, and pica is the same name, where people can eat mud, and if they eat mud, they can eat the eggs of these worms with them. So, and there is different theories about pica, why children eat mud, and there are different theories. They say that they are lacking of iron in the body or whatever. So you can review this. Ascaris is known also, apart the adult ascaris is known to travel ectopically, and notoriously it goes to the biliary system. They goes to ampulla vata, and then they cause pancreatitis. In Southeast Asia, almost 40% of pancreatitis is caused by ascaris, because it goes to the ampulla vata and causes disturbance there, leading to pancreatitis. Secondly, it can go into the biliary system and causing intestinal obstruction, biliary obstruction. And in India, 40% of biliary obstruction has been proven to be due to ascaris. This is what we call wandering ascariasis. So this is important, not only the intestinal bolus, which causes obstruction, but also the worms in the ampulla of vata causing pancreatitis, and the wandering ascaris in the biliary system causing obstruction. Clearly, if you see a case, of biliary obstruction, you go through the diagnosis, which clinical diagnosis of there is jaundice. Second stage, this is obstructive jaundice with itching and green-yellow coloration of the jaundice. And then by ultrasound, you can see peripheral dilated biliary system, and you can see the obstruction in the biliary tract. How would you think that this is due to ascaris? If you have an evidence that there is ascaris in the intestine, then this is one way. Other ways are by eosinophilia, and in the ultrasound itself, it can tell you if this is a stone obstructing the biliary system or if it's an elongated structure like a worm. Okay, and many cases have been diagnosed by ultrasound. The way out of it is you can do ERCP, the therapeutic ERCP, which is endoscopic retrograde cholangiopancreatography, ERCP. You can apply and take the worm out from just like taking a small stone from the biliary system by ERCP, and then that is the way. The treatment of ascaris is first environment, and here because of reinfection, unless you teach the children about how they contract ascaris, then you are going to give drugs. They're going to reduce intensity. They are going to reduce morbidity, but they are not going to lead to elimination of ascaris in the community. Unless the children cooperate, they wash whatever they eat, they wash their hands, and stop defecating in the soil, in the earth, and follow the proper sanitation, use of toilet, and the rest of it. So unless they do that, the albendazole will only reduce the intensity and the prevalence of the disease. The treatment is obviously clearly albendazole, A-L-B-E-N-D, albendazole, Z-O-L-E. I'm stressing it because this drug has made a major breakthrough in the treatment and reduction of morbidity of ascariasis. Albendazole can be given orally. The tablet is 200 milligrams. You can give 400 milligrams. The drug can be repeated safely every 6 months. And then by reducing the intensity, you are reducing the excretion of eggs from the humans, and the less eggs in polluting the earth or the soil, and less infection. So it has to be repeated according to logistics, because if you can treat every 6 months, is better than treating 1 year, but logistics is difficult sometimes. The important aspect of albendazole, it is well tolerated. It has a good margin of therapeutic safety. It has a good margin of less effects and tolerability by the children. So it's a drug which is useful. Ivermectin also has an effect against worms, but less than albendazole. So I don't think you need to add ivermectin, except in certain worms, which you will come to it. Maybe strongyloides, you can give albendazole plus ivermectin. But here for Ascaris, albendazole alone, repeated every 6 months or every year in a preventive chemotherapy, that is mass chemotherapy. I would like just to remind you that we are talking about school children. Okay, these are children in the school and school age children. These are children who are of the same age like those who go to school, but outside the school. In public health, this group of people who are outside the school, if you are doing it by school, you miss all those who are outside the school. So it is important to find a way of getting these school-aged who are not in the school to be treated as well. This is very important. And you could do it either house to house, picking up those who are not in school and giving them treatment, or advertising through whatever means to get all these children. Because if you really aim at controlling ascaris in a community, then you really have to target the right population. And the right population are children in the school or outside the school. So with that, I think we have covered an important worm, which is ascaris. Roundworm may cause some abdominal symptoms. It may cause wandering ascariasis in biliary system, pancreatitis, but also it can cause larval pneumonitis or eosinophilic treat, not with to treat with corticosteroids and later with albendazole. That is what I had. I didn't have time for another worm, but it is good that we do 2 worms or 3 worms per per day. That will take it the message home. So lastly, the message home is intestinal worms are common. They are geohelminths. They are soil-transmitted helminths contracted from the soil, eggs in the feces, eggs contaminating the soil. They get swallowed. They have different life cycle or different infective eggs, and only a small number like Ankylostoma duodenale is contracted by penetrating larvae in the skin when you go barefooted. The general symptomatology among children who are the targeted population is stunting of growth, anemia, and impaired cognitive function. Treatment is by albendazole, okay? Maybe with ivermectin in certain cases, but albendazole repeated every year or 6 years is the drug of choice. For an individual who left the area, you can treat to cure, meaning that you can give albendazole and then repeat it in 2 months' time and then examining till the worm disappears completely. In an endemic area where transmission is continuing, the treatment is yearly treatment of children in the school or children out of the school every year. With that, I would like to thank you for joining me in this lecture. Hopefully, we'll continue some of the other intestinal worms, other soil-transmitted helminths or geohelminths next Sunday. Thank you very much indeed.